everybody. Welcome to Fireside Adoptees. We are holding a special event called Amplifying Advocacy Voices. We're super excited just to be able to introduce people who are really passionate and making a difference in their way for everybody in their specific area. So we are excited. This is our first time doing this specific um, kind of event. So hopefully there'll be more to come. And yeah, and our guests today are Linnell Long from Intercountry Adoptee Voices. We have Dr. Barbara Sumner, and we also have Andrea Coates.
Thank you. I have a PowerPoint presentation, so I'm going to go ahead and share that now. Okay, so I was asked to speak about the foster care system and about advocacy within foster care, just due to my own kind of personal experience with the foster care system, not as a person in the foster care system, but I'll talk more about that. And then also in helping in my professional experience with children and adolescents who are in the foster care system. And then also how that intersects with my advocacy work in the adoption space as well. And so this presentation will critically examine failures within the U.S. foster care system affecting vulnerable children. And I'll discuss the foster care system's breakdown, which profoundly impacts children's lives and well-being across the United States. And I will also discuss the need for reform and urgent advocacy. I am a search angel. I've been a search angel for about 15 years. My best friend is adopted, and one day told me at a baseball game that both of our children were playing in that she didn't have that her birth certificate basically was falsified, and I was completely astounded and didn't even know what to do with that information. And we forged a friendship, a very deep friendship, and she asked if I asked if I could ask more questions about her adoption. And she shared with me all kinds of information. And I've always been a very curious person, a researcher just by nature. And so I asked her if I could help her with her search. And we met one day at a coffee shop, and she handed me her file folder of information, and it was not lost on me that day that she was giving me everything she knew about herself, which was very little. And that is what started my journey into this community. Um, and and so I am a search angel. I'm also a licensed clinical social worker, and I am proud to be considered by many of my friends within the community an adoptee ally. I am also the daughter of a former foster youth who became pregnant with me while she was in foster care as her only way to escape a system that had already failed her. My mother's childhood began with joy and stability in Astoria, Oregon. She played softball, took dance lessons, and was even crowned a regatta princess. But by age 14, everything had changed. Her mother died suddenly, her brother was drafted into the Vietnam War, and her father, who was grieving and overwhelmed, died by suicide. So, left without family nearby, she entered foster care, where her life was marked by instability and harm. At age 16, she sought a way out. She believed that by having a baby, she would no longer be a ward of the court. Instead, she found herself in another unsafe situation with my biological father, who was a gang member at the time. And she ended up enduring domestic violence while raising eventually 2 children. Her determination never wavered. When I was 8 and my brother was 6, thankfully, she found the courage to leave and begin again. So, growing up, I often heard my mother's stories. She spoke of the losses, the severe abuse, and the ways that the system stripped her of her identity, even forcing her to use a different name at one point. I witnessed the impact of her trauma in the form of flashbacks and painful memories. And her story was not just her past, it shaped my childhood too. I wish I could say today that foster care has changed, that children are no longer exposed to the kinds of harm my mother endured in the 1960s. But the truth is that many of the same systemic failures remain. Children still fall through the cracks, families are still broken apart, and survivors like my mother, who has passed away, remind us that we have so much more work to do. As of September 2023, there were 343,077 children in foster care in the United States, with over 525 children having entered or exited the system throughout the year. The average duration of stay in the foster care is often more than 18 months, indicating prolonged exposure to systemic conditions. These statistics, sourced from USA Facts and OAI Cares, illustrate the vast scale and reach of the foster care system, highlighting the significant number of children affected annually and the extended time span that many of them spend in care. Children in the foster care system face a significantly higher risk of mortality compared to the general child population. According to JAMA Pediatrics 2020, the mortality rate in foster care is 35.4 deaths per 100,000 person years, compared to 25 deaths per 100,000 in the general population, which is a 42% increased risk. For children aged 1 to 4, the disparity is even more pronounced, with rates of 50.7 per 100,000 in foster care versus 27.5 in the general population. These figures underscore the urgent need for systemic reform to protect the lives of children in care. Abuse within the foster care system remains a pervasive issue, exacerbated by inadequate oversight. States frequently fail to track incidents of abuse in foster facilities, as reported by U.S. News in 2024. Abuse by both foster parents and peers continues to be reported nationwide. A notable example is the Mentor Network, which is a large for-profit provider where 86 children died over a 10-year span. These failures highlight the lack of accountability and the dire consequence of insufficient monitoring and regulation. Several systemic issues contribute to the failures of the foster care system. These include a lack of consistent oversight and reporting, understaffing, and high caseloads that hinder caseworker effectiveness, the privatization of foster care services, and the prevalence for-profit facilities creates gaps in accountability. Additionally, prevention efforts are underfunded, leading to unnecessary removals that could be avoided with early family support. These structural problems undermine the system's ability to safeguard children and necessitate comprehensive reform. Children in foster care often experience severe psychological and emotional consequences, including trauma, PTSD, and attachment disorders. Many age out of the system without permanent family connections, increasing the risk of homelessness, incarceration, and mental health crises. The elevated mortality rate is the most extreme outcome, as documented and already discussed by JAMA. These long-term impacts reflect the system's failure to provide stable, nurturing environments and highlight the need for targeted interventions to support affected youth. Effective advocacy and reform strategies include mandatory public reporting of abuse and deaths to ensure transparency. Strengthening oversight of foster parents and facilities is crucial for accountability. Funding preventative services can help keep families intact when safe, reducing unnecessary placements. Providing comprehensive training and support for foster parents enhances care quality. Prioritizing permanency through reunification or guardianship over long-term institutional care can improve outcomes for children. And these solutions aim to address systemic flaws and promote a more protective and supportive foster care environment. What I do want to talk about regarding the last portion of the advocacy solutions is adoption as it intersects with foster care. The fact is that between 45 and 50 or 55 couples there are 45 to 55 couples per every newborn baby in this country, waiting to adopt a newborn baby in this country. And because of that, people are looking to foster care for their adoptions. And foster care very much sometimes turns into adoptions, which means that when these children are adopted through foster care, their records are sealed too. Their OBCs are sealed too once that happens. And I just wanted to take a minute for anyone who doesn't know about the dual birth certificate system in the United States. When a child is born, a birth certificate is issued, and the actual people who parented the child, most of the time in the case of adoption, of newborn domestic adoption, we see the mother's name on there. Sometimes, in rare circumstances, the mother and father, the biological mother and father, are listed on that original birth certificate. However, when a child is adopted, an amended birth certificate, absolutely 100% falsified, is issued, and the original one is sealed. So currently, 16 states are open with no restrictions. 19 are open with restrictions. And let's see. And 15 states plus the District of Columbia are closed. I like to use adopteerightslaw.com. This is Greg Luce's site, and I'll be glad to put this link in the chat when I'm finished with this. But I highly recommend this site for up-to-date information on the status of the OBC laws in the states. Here are the closed states: California, Florida, Kentucky, Michigan, Mississippi, Nevada, New Mexico, North Carolina, North Dakota, South Carolina, Utah, Virginia, West Virginia, Wisconsin, Wyoming, and the District of Columbia. So how can you be an advocate? How can I be an advocate? Well, first, when it comes to foster care, be aware. Be aware of what's going on with the children around you. When I've learned about the deaths of the children in foster care, these were kids who were oftentimes bruised and battered. They went to school, they talked about what was going on, they asked for help. So be aware. If you're a mandated reporter, which in some states, we all are mandated reporters, but teachers, medical professionals, usually people with licenses, are definitely mandated reporters. But if you see something, say something. This is an easy way to help keep children safe. But we do know that in so many cases where these children died, there were signs, there were things that were seen later as odd. And so be aware. You can become a court-appointed special advocate. This is like a guardian ad litem system. You can volunteer to mentor a person in the foster care system. You can support organizations and established efforts for OBC change. You can join others in family preservation initiatives. Family preservation and prevention before a placement is even needed is really key here. So family preservation and prevention, wraparound services, services where therapists can come into the home and really just care for these families that don't need to be separated most of the time or a lot of the time. And of course, we all want children to be in safe places. Of course we do, but there are so many other things that can happen first. So family preservation and preventative measures are so important. So anytime you have a chance to get involved with that, if that's something that's that you have the opportunity to do, that's something that you can do to really affect change. And like Linnell said about educate yourself about the laws, about foster care laws, OBC laws, adoption laws. Um, it's very frustrating that in the United States, all of these laws are different for every state. Going back to resources are different in every state. Resources could be different in every county of every state. Um, and so we really need to be aware of what's available, what our laws are. It's really one way to be a good advocate. Leverage your influence professionally, personally, whenever you have the opportunity to talk about these issues and issues that are important to you that affect children, foster care children, adopted children. Leverage your influence. When I work for Anthem Blue Cross Blue Shield, and when I was a behavioral health case manager for a state employee plan, um, I noticed that adopted children were overrepresented in our high acuity facilities. And I noticed that we weren't finding out about them until their second or third hospitalization. And so I worked with my medical director and I worked with the people at the state plan, and we developed basically a mailing that went out to people that said, if you have an adopted child or if you are thinking about adopting, please reach out to us as soon as that happens. We want to connect you with services. We basically made an early intervention kind of program. Would I prefer that we not have to deal with this at all? Yes. The fact of the matter is children are being adopted, and what do we do with that to ensure that they're getting the help they need right away, and that we're not waiting until they're 13 and 14 and experiencing distress and identity crises and needing hospitalizations. We want to really provide support and really more than encourage parents to really get trauma informed care for these children way before they need it. Um, One lesson that I learned at the very beginning of my journey into this community was that I needed to listen and learn. I just needed to be quiet and I needed to listen and learn. I'm still doing that. Um, I think it's imperative for allies, especially, to listen and learn. And also, I think that we need to help others, especially our younger generation, become genealogically aware. Um, my I have three children, and they were between the ages of 6 and 13 when I started doing search angel work. And they knew that when they heard me say, I found her from my office, that they knew I found somebody's birth mother, and all three of them were as excited, or in their own ways excited, as I was. I was very open in age appropriate ways about what I was doing and why I was doing it. And my three children are genealogically aware, and I think that we need to give that information to people younger than us, so that they have this information, so that they are aware, so that it affects their decisions, and that they can help others, knowing that genetic mirroring is important, that maternal infant separation is tragic and should not happen. And also, I want to say that when I first started doing search angel work for my best friend, it was 7 years before we got a good match, because I started probably 2 years before DNA was available. And the first kits became available with 23andMe, and we just waited and waited, and she got on Ancestry, and we waited and waited. But in that time, I decided that I needed to learn. I read books, I read The Girls Who Went Away, I listened to podcasts, story after story after story. And so I want to say to those of you on this call who are adopted or who are former foster youth, keep telling your story, because advocates or potential advocates, potential allies, people who want to get involved but don't know exactly how, we learn from you. And this is telling your story is how we learn. And then also we need to educate others, just like I was talking about, becoming, helping others become genealogically aware that this is not rainbows and this is not family building, that this is trauma, that this is real trauma. So in conclusion, the foster care system was designed to protect vulnerable children. It often inflicts harm due to however, it often inflicts harm due to systemic failures. With accountability, prevention, and true support, I think change is possible. We need urgent reform, transparency, and investment in preventative measures. And like Linnell, I'm going to encourage you to take care of yourselves in this process. Um, the stories in foster care are horrendous. Um, Listening to adoptee stories and the tragedy of separation and loss and trauma, it's hard. However, in order to learn, we need to listen, and we need to subject ourselves to hard things in order to receive our motivation to keep going. At the same time, vicarious trauma, like Linnell said, is real. And so we need to honor our bodies and hold space for our feelings. We need to know our triggers. And so we need to be aware of that. We need to take breaks when needed. And we need to be kind to each other and kind to ourselves in this work. Thank you. I want to say thank you too for having me, Amanda, Jude. Thank you. I want to second what Barbara said about the right to know. I know anytime I have a chance to talk to anyone, um, I talk about original birth certificates, because I think it's just in the United States, it's just not well known by the general population that adoptees don't, the majority of adoptees don't have access to a government document. It's really mind blowing to people when they find that out. And I went on vacation in March and was on a train down the coast and got into a really nice conversation with a young couple, and it started out about cemeteries, it went to DNA, and it ended up in original birth certificates for adoptees. And so I tell anyone I possibly can about original birth certificates. So I say, like, start somewhere, and I found that that's the easiest place to start for me in the United States.